Hey everyone, my name is Dr. Matthew Hernandez, and you're listening to episode 00 of the Ethos Athletes Podcast. And in this podcast, I want to do a few different things. One is I want to introduce you to myself, who I am, and two, I want to be able to tell you a little bit more about this podcast, and why I'm creating it, who is it for, and what we're hoping to accomplish with it. And so for starters, I'll go ahead and give you a little bit of introduction about myself. Again, my name is Dr. Matthew Hernandez. I'm the co-owner of Ethos Integrative Medicine here in Scottsdale, Arizona. And I specialize in regenerative medicine, where I use PRP therapy, stem cell therapy, prolotherapy to treat individuals who have joint pain. And I primarily work with the CrossFit population. And that's really who this podcast is geared towards. And there's a few reasons for that. So I'm a firm believer in having patients understand their injury. So whenever an individual comes to see me because they're injured, I do my best to make sure they understand what's going on in the injury. And that typically helps with them understanding what their limitations are until we can completely get everything fixed, and why we're doing the things that we're doing. And part of them understanding their injury is also knowing that, or also having the understanding that I don't do everything that they may need. And so I'm a big proponent and I'm a big advocate for working with other healthcare professionals who specialize in various areas. At the end of the day, yes, I'm a doctor, but we all have our place in the healthcare system. And so I work with a lot of other healthcare professionals to make sure that my patients get the best care possible. And I do that because there's a big difference between putting a Band-Aid on something and just having the patient re-injure themselves down the road, and comparing that to the patient actually getting better and not having to worry about re-injuring themselves again. And so one of the things I always tell my patients is the fewer times I'm seeing you, the better I'm doing at my job. And so that's kind of my goal with everything. And so some of the things I'm absolutely against, that I cannot stand when people tell me these things, are when they went to another doctor and they were told that they had to stop doing CrossFit because of whatever reason. There's a few instances where that may be true, but realistically, there's ways to get around stuff, and there's ways to fix things properly to where that individual shouldn't have an issue. And so I see a number of patients that, have been told that, and, we've been able to get them better and back to doing what they love. And I also don't like individuals using age as an excuse, like, oh, I'm just getting older. And yes, there's a component to that. Absolutely. But I don't think it should be used as an excuse. There are definitely ways to mitigate that. And so, individuals saying that, I understand the thought process behind it, but I don't think that's always a valid reason for you to be hurting, tired, etc. And then another thing I can't stand is unnecessary treatments. And so I'll have patients come in who have seen 5-6 other healthcare professionals, and they came in with, let's say, a rotator cuff injury, and so the therapies that were being done on them, aren't going to do anything for rotator cuff injury. And I can't stand when individuals' time and money is wasted on treatments that aren't going to do anything. And it's not necessarily that they were seeing someone bad. It's just that they weren't seeing someone who specialized in that particular injury. And so again, that's why I'm such a big advocate of working with other healthcare professionals who are very good at what they do, and and they get great results, and because of that, they're efficient at treating a given area or a given condition, and they don't waste an individual's time and money. and nor are they taking shortcuts that result in poor care. And so, all of those beliefs have kind of inspired me and encouraged me to do this podcast, because I get questions in my office and at the competitions that I work at from CrossFit athletes asking, what can I do for this, or what can I do to, improve this lift, or what kind of nutrition plan should I be following? And yes, I can probably answer that, but I can't answer that as good as someone that, that's all they do is work on that aspect. And so, that's really what inspired me to do it. Is I want our listeners to have a basic knowledge of various topics that is in the fitness world, so that they can understand where to go when they have a problem that needs fixed. And fortunately, here in the Phoenix metro area, we have a number of individuals that are experts in various topics. And so, on this podcast, I'm wanting to bring in physical therapists, nutritionists, massage therapists, chiropractors, individuals that work with CrossFit athletes and that know what they're talking about, so that you can learn a little bit of the basic knowledge that they know, and you can understand when and who you should go see when a problem arises for you. And so the individuals I believe will benefit from this podcast are individuals who are wanting to improve their performance, but it's not necessarily limited there. I see games athletes and regional athletes, but at the end of the day, the majority of my CrossFit population that I treat is the average person that's wanting to get healthier and does CrossFit for fun, not necessarily for competition. And that can range anywhere from those individuals in the middle to beginners. And so if you fall in those ranges as well, and you're just wanting to improve your workouts overall, your overall health, etc., this podcast can help you do that. And another group I'm hoping this will help is healthcare professionals that work with this particular population. And again, the reason is because there's not one healthcare professional out there that knows everything and can do it all. And if they do it all, they're probably not doing something well. And so, I hope that you can listen to the other healthcare professionals that come onto this podcast and talk about their expert, what their expert topic is, and know either from that podcast how to either improve your patient care, or also to know where to send individuals that you may not be able to help, or you don't know where to start, or at least know who to call to figure out where to start if you want to do that as well. And then last but not least, I get a number of questions, like I said, but the people that get the most questions by far are gym owners and coaches. And I hope that this podcast will serve as a resource for those individuals. That way you can know where to send your clients and your gym members, and you can understand when you should be looking for a given fault in their lift, etc. And obviously you're going to know that, but if there is a fault, who do you send them to, and who's going to have the most benefit for when you do send them there. And so I hope that this podcast will benefit gym owners and coaches and help you give more value to your members, and be able to be a resource for them, or a more knowledgeable resource for them. So that's a little bit about myself, what I hope to do with this podcast. I've already recorded a few other episodes. And I'm really excited to launch this. I have had a physical therapist come on. I've had a nutritionist come on. I had my friend Eric Miller come on. He's the one that introduced me to CrossFit and got me into the CrossFit world. And so, yeah, I'm excited for this podcast and to become a resource for the individuals here that may be able to use it. And so thank you for listening, and until next time, we'll catch you later.